Hello, I'm Dr. Dennis McKenna, joined again today by Dr. Venditti, our Hospital System General Director. This is the update from Albany Med related to COVID-19. Albany County reported this morning that there are 52 positive cases of people in the county with COVID-19. In the hospital here, we currently have 5 patients, 4 on the floor, 1 is in the medical ICU. We have an adequate number of ICU, ventilators, and negative pressure rooms, as well as staff to care for all the patients that we're currently seeing in the hospital right now. In addition to that, we have patients under investigation, approximately 20 of those. Our testing area outside is still open. The drive-through will close as of 9 o'clock this evening, and we will transition from a testing tent to an evaluation tent, and that's in coordination with St. Peter's Hospital as well.
I would also add we continue to track our personal protective equipment, masks, gowns, and the like, and we have very adequate supplies, Dennis.
Great. We also did a video today with Rebecca O'Donnell, Director of Epidemiology, as well as Dr. Arup Day. This is specifically on the idea of personal protective equipment. So if you have an opportunity on our intranet page, we'd like our staff to take a look at that for more information about PPE.
That's great.
So here's some questions. Fred, today we both participated in a call by Dr. Zucker, Commissioner of Health for New York State. What did we learn?
So what we learned, actually it was a request for information from the Department of Health. They had all of the hospitals in the state on the phone, and what the commissioner was asking us for was sort of a catalog of all the important resources that would be necessary for caring for a surge of patients. Our bed status, both med-surg as well as intensive care, ventilators, etc. So we're well along the path of understanding what our resources are. He also wanted to hear what our plans were for dealing with a surge of patients. And again, our incident command has been operational for about 2 weeks now, and I'd say 90% of what he's looking for has all been worked out by that group.
Great. Speaking of the commissioner, the governor's also made some comments about non-essential businesses and what people need to be prepared to do.
Yeah, that's right, Dennis. So the governor was at his press conference this morning. He said that he was asking all non-essential businesses in the state to close as of Sunday night. We are an essential business, and all our employees are essential employees. So while that applies very broadly in the community, that doesn't apply to us or our employees.
Now that doesn't mean that there are some people who might be able to work remotely, and we're still doing that aggressively.
That's right. We're looking to have people work from home, but we still need their efforts to provide care for our community.
Let's talk a little bit about social distancing. What are people doing at the medical center on that area?
So a lot of our conferences have moved to WebEx conferences, the resident training conferences, grand rounds, etc. And frankly, we've even started to create what I would call digital meetings. So the command group, the incident command group, as of today, now has a relatively small number of people in the room with everybody else on the phone as we do our briefs. And we're also going to do that for the safety brief. It'll be a virtual meeting on a go-forward basis.
How are we able to sit next to each other?
So we've talked about having each of us self-monitor, and that's something that we're going to roll out for the entire staff. So we each took our temperature this morning. I didn't take yours. I took my own, and Dr. McKenna took his. And then we also assessed whether or not we had any symptoms that might be relevant to COVID-19. So my temperature this morning was 97.8.
I'm 98.5. Okay, good. So we're safe, and we'll continue to monitor ourselves going forward, and our work staff will do the same.
Exactly.
Okay, very good. There was a meeting this morning with the surgeons. The OR steering committee.
That's right. So yesterday you heard us talk about a change in how we're going to handle patients with non-essential surgical procedures, perhaps elective surgical procedures. So there was really good dialogue this morning. The OR steering committee has all the service chiefs, the surgeon leaders. There's a full commitment to that, and we're going to go forward with it. Now, another thing that Dr. Zucker said during the meeting earlier today was that he wants us to stop elective surgeries, his words, as of Wednesday. So our plan actually fits into, I think, what he's looking for, and ours goes into effect on Monday.
Okay, very good.
Great.
Okay, so let me end with this. It's been a long week for everybody. We've been getting some nice cards from children in the community. This is sent to the entire workforce. This card says, "Thank you so much for all you do to make everyone safe and healthy. You are so awesome and caring and kind and amazing." So that's our workforce, and we share this with all of you. It's been certainly a long week. We'll be here this weekend doing the same thing.
We will.
We'll pick this video up on Monday, and we ask all of you out there to continue to take care of yourself, take care of each other, and we'll see you on Monday.